8 at 6 starts now.
A patient with Ebola-like symptoms at Yale New Haven Hospital has tested negative. Let me repeat that, negative for the disease. Good evening, I'm Ann Nyper.
And I'm Keith Kuntz. It is certainly a day of heightened concerns in New Haven. The Yale doctoral student has been receiving treatment in an isolation unit at the hospital. Tonight, we are still awaiting official confirmation on that patient's status from the CDC. Let's get the very latest now from News 8's Jocelyn Mementa, who is covering this story from New Haven. Jocelyn.
Keith and Ann, multiple sources told us the test came back negative, and even they are not certain how the result came back so quickly. The chief medical officer at Yale New Haven Hospital just released this statement, and I'm quoting now, "Due to an overabundance of caution, before we fully rule it out, we will wait for the CDC official confirmation of the test result." He also says the hospital will continue to monitor the patient in order to ensure the safety of the staff and community. Also from the State Health Department tonight, test results received today from the Massachusetts State Public Health Laboratory were negative for Ebola. This is good news for the patient at Yale New Haven Hospital. Confirmation tests from the Centers for Disease Control and Prevention are expected as early as tomorrow. Again, the male grad student has tested negative for Ebola, and we could get confirmation from the CDC by tomorrow. Keith and Ann?
Thank you. It has certainly been a very stressful day for health officials in this state. Jocelyn, do you think there's still reason to have heightened concerns about the virus here in Connecticut?
Well, health experts tell me we should be vigilant about contracting any type of virus, especially with flu season just around the corner, which means washing your hands and getting a flu shot. Back to you.
All right, thanks so much. Those two Yale doctoral students left for Liberia on September the 14th. They were helping the Liberian Ministry of Health work on computer disease tracking systems. They volunteered to sequester themselves for 21 days as a precaution upon their return. 3 days ago, Yale announced those two students would not be quarantined, saying they were never exposed to the deadly disease. Yale President Peter Salovey releasing a statement earlier today saying he was confident the students took the necessary precautions, saying in part, quote, "The doctoral students who visited Liberia are knowledgeable about public health. They have reported that they were not in contact with Ebola patients or caregivers in Liberia, that they carefully followed recommended travel and hygiene precautions during their stay in that country, and that they have continued to do so since their return."
All right, of course, this has been a day of great concern over at Yale New Haven Hospital as officials waited for the initial test results to come back on that researcher admitted with the Ebola-like symptoms.
The patient is still being closely monitored as we speak. News 8's AJ Walker joins us live from outside of Yale New Haven Hospital with how things are standing right now. AJ?
And although preliminary results for that Yale Ebola patient with Ebola-like symptoms have come back negative, the preliminary results have, we still have to wait for confirmation from the CDC to give the final confirmation. And now looking back, we have to ask, could this have all been prevented if Yale had just isolated those students from the very beginning and run some tests? And could this have avoided this entire scare?
We had already identified where we would put this patient in isolation and precautions following the CDC guidance and actually going above and beyond that.
At today's press conference about Yale New Haven Hospital's Ebola scare, doctors say they were ready for an Ebola patient. That patient came sooner than some had expected. City officials tell us one of two graduate students who recently traveled to Liberia after studying disease tracking systems started showing Ebola-like symptoms, causing panic throughout the city. But the school may have been able to prevent all of this by putting the students in isolation after they return. Instead, they volunteered to stay away from the school, even though Yale staff said they didn't have to.
Has been in voluntary sequestration since Saturday.
Tuesday, we visited the Yale campus to talk to students who had gotten a letter from the school about those students. Some said they would have been more comfortable if they had been quarantined.
They wouldn't mind. It would be nice to have them quarantined just to see if any changes do start to happen within those two students.
The situation is causing concern throughout the city of New Haven.
We had on site as well our acting director of public health. They have been on top of all of this. They are currently in a preventive risk exposure investigation.
The hospital says the Ebola virus isn't airborne and can only be spread by coming into direct contact with a person's bodily fluids. But in the letter Yale sent out to students, they say the students in question were not in contact with any Ebola-infected patients.
And we're getting word that the CDC could have results as early as tomorrow on the final test, and we can finally say it's negative if that's the information that they come back with. And again, Yale never would confirm if that patient was one of the graduate students who had returned from Liberia. We got that information from a city official, but I have to question now if they intend to test or isolate that other student to prevent another scare like this. For now, live outside of Yale New Haven Hospital, AJ Walker, News 8.